In response to COVID-19, AmeriHealth has been very proactive in its approach for treating patients, especially the mental health population. In preparation for this, our Chief Clinical Officer, Carl Weininger, contacted Optum to request all services be made via telehealth to ensure that there are no mental health crises going on during a possible quarantine. At AmeriHealth, we are taking precautions at all of our locations, including more frequent regular cleanings and sterilization of the different areas. I'm going to let Carl now speak to the telehealth for all of our providers.
Morning. We are excited to be able to offer mental health services. This is including paraprofessionals, non-clinically licensed providers for mental health services. So the only service that is excluded at this time for us is respite care, and we will be discussing some of the policies and procedures we're putting in place for those types of group settings to be able to prevent the spread of illness and to be able to still provide services for our clients. So we have sent out an email asking each of you to get a free VC Messenger account utilizing your AHC email account. Once you've secured that, you can invite your clients to that platform by simply adding them to a contact using their email address after they've set up a free account themselves. We are encouraging you strongly to reach out to all of the clients right now, not waiting until we can't really go and visit them, potentially with quarantines. So at this time when sickness isn't a huge concern in this area, please be reaching out, being proactive, and helping them get onto those systems and start utilizing the telehealth system now. This will be a great opportunity for us to not have any lapse in services for this population that's high risk, especially where a lot of them are probably very scared and paranoid, and it's a good opportunity for us to be able to help them. If your clients are unable to get on to the internet, if they don't have the access, they don't have a smartphone, they don't have internet services at home, services can be done telephonically. At this point, we're just asking that you document very well in your notation, in your notes, what your reasoning is for doing telephonic care, indicating that what the roadblocks were. We encourage you first and foremost to try to get telehealth to work with each of your clients. Certainly reach out to me. Justin, our IT provider, can also help make sure that you're getting on to VC, and can also help walk through that for clients. I think that's a start.
Yeah, it's just really important for all of us to make sure we're going and working with these clients here at the early on in the week. We don't know what's going to happen later on in the week or the weeks to come. I don't think this is something that we need to panic about, but we need to prepare for. So opening those lines of communications are going to be essential. Getting on VC, seeing if they have a desktop or laptop or something where VC is going to be able to be downloaded, or a smartphone or tablet. If they don't have those things, we can start looking to see what it is. Maybe they have a friend or family member, something that we can maintain contact. And again, this is for the counseling, right, and with the mental health professionals, but then also it's with community-based rehabilitation. It's for case management, peer support, family support. It is so that contact is not lost with their workers, that keep them in that stable environment. Also, those in the community who may be working with other agencies, that maybe other agencies aren't aware of this, please contact your agencies and let them know so that your loved one is getting the care they need. And make sure that they do not get a lapse in services during this event. Also, if you have family members, it's a good time that struggle with mental health. It is a good time to open those lines of communication and to not wait to do that. Now's the time to just prepare for those things, and we know that the mental health population is a little bit more at risk for having a crisis with having paranoia or anything else. So it's just important that we make sure that we have that ready. In the event that there is a sickness, we do know that we practice integrative care, and many of our mental health clients also see us for primary care. In the event that they are sick, if they are mild symptoms, we encourage them to stay at home. However, if they need to see a medical provider, we want to get them in to the clinic. And that's when you would bring them there before you walk into the clinic, so we don't expose other patients. We make a phone call. Now the patient can make a phone call, their worker can make a phone call. Make that phone call so that people in the waiting room, the medical staff, aren't exposed. So make that phone call. They'll wait in their car. We have a high volume of patients, so if you don't get through the first time, know that we are open 8 a.m. to 8 p.m. And if you're on hold, just wait there on hold. They will get to you. Then we'll have a protocol in place to then bring you to the side of the building, and there's a side door that we have quarantined off to bring someone into an exam room, and that's when we can do the testing. We rule out influenza A and influenza B with a rapid test. If those are ruled out, then we send it on. We'll send the lab on to test for the coronavirus. So that's kind of how it's working. But just ensure that if you're having those symptoms, to please not just walk in. Know that we are there to take care of you. We'll give you the best care possible. But to wait in your vehicles, and we'll work with you there, and then follow those procedures in place to protect everyone. Know that here in the mental health clinic, we're doing everything we can to sterilize. If you're feeling sick or have any symptoms, please coordinate that with your mental health provider. And then we will have further information from our medical staff just regarding our response to the current situation.
Lastly, we will also be holding a lot of our meetings using VC or another platform potentially to also avoid having those group settings that's also going to help create that safety for us. And so make sure that you're checking your emails frequently on a daily basis to get updates on when meetings are occurring so that you can get the most up-to-date information so that you continue to do your jobs.
If you have any questions, please reach out to Carl or myself. IT questions. We're fortunate to have a great IT professional here. Get with Justin. Let us know if there's anything we can do to support you working with your clients. And let's just get after it in preparation and get things taken care of.
Thank you.